As much as we'd like to put the pandemic behind us, the variants and recent rise in COVID-19 cases continue to cause major concern. And our medical expert, Dr. Payal Kohli, is here to help keep us up to date with the latest information. Okay, so Dr. Kohli, thank you so much for being here. And a lot of our viewers are confused. So we need you to clarify. What's driving right now the increase in COVID-19 cases?
You know, we have created the perfect recipe for cases to go up. So think about it. Vaccination rates have dropped off. There's a new, more contagious version of the virus, and the masks have come off. So it's literally like driving your car with the accelerator and no brakes.
Scary.
Yeah.
So, Dr. Kohli, with the potential need for a booster for people who are vaccinated, people who aren't vaccinated might say the vaccine's not even working against this new variant. Could you explain that?
Yeah, that's a good point, Jeff. So the booster is really just meant to sort of, it's almost like going to the gym for our immune system. It's meant to flex its muscle. It's meant to teach it the new variant and how to fight it a little bit better. That doesn't mean that the vaccine is not working against the variant. It just means we need to boost the response that we have.
Let me have a follow-up question as well.
Please.
For somebody on the fence, because we talk about this a lot on our show, you're not going to change somebody's mind that doesn't ever want to get that vaccine, right? But for somebody that's on the fence that might have had a family member, a close friend, what would you tell them to push them over that edge to say, you're going to want to get this vaccine?
I would say 99% of the deaths that are occurring right now are in unvaccinated individuals. This has become the pandemic of the unvaccinated. And if those unvaccinated individuals met us halfway and got the vaccine, we'd be done. We'd be done with those masks. We'd be done with the social distancing. We'd be done with the restrictions.
Wow.
Okay, so you know what my follow-up question is going to be, because this has been the #1 thing people have been saying to me. There are people who got the vaccine and they're still getting COVID. So, I mean, and that's the thing. So how do you combat that? But also, is it necessary to go back to masks because of that reason?
So great point and great question. We know that no vaccine is 100%. We expect some breakthrough cases. But using that argument is sort of like saying seatbelts don't work because people can still get injured in car accidents. Seatbelts dramatically reduce the risk of dying in a car accident. But yes, you can still have injury, and that's exactly what's happening. So there are some breakthrough cases that are occurring in the community, but they're occurring because there's so much virus. They're not occurring because the vaccines are failing.
And for some of the people, the few people that are getting the breakthrough cases, they're more likely to be asymptomatic or less symptoms, right? They're not the ones that are being hospitalized in the ICU.
That's exactly right. In fact, we're thinking we're even underdiagnosing the number of breakthrough cases because a lot of people don't even have symptoms when they get a breakthrough case, which is really what we wanted all along with this vaccine, was to turn it from a deadly condition to something like the flu that you can get. You can, still live with your life and not have any consequences like your poor Eric does.
I know, which you've been an absolute lifesaver for our family. But somebody wrote in yesterday, and it actually broke my heart, because they were saying, I'm sick and tired of being lumped in, and I'm just paraphrasing. I'm sick and tired of being lumped into people that can't get the vaccine or won't get the vaccine. I can't get the vaccine. And I don't know this woman's circumstances, but can you elaborate how all of us hopefully getting the vaccine with herd immunity, it protects people like her or our children or Eric who can't get the vaccine because of his double lung transplant?
We are the shield, you guys. We're the shield for people who can't yet get the vaccine, like our kids under 12, or the people who can't ever get the vaccine because of their medical conditions. And if the virus can't find a host, it's going to die out. By not getting vaccinated, we're giving it the opportunity to find a host. And by putting those masks on, we are preventing it from spreading as efficiently as you had said, Erica.
Even if you're vaccinated, should you be wearing masks?
This is different now, and the answer is yes. So, I never took my mask off, ever. But for a lot of my patients, I told them, if you're vaccinated, you don't need a mask. But now that we have so many Delta cases, that mask needs to come back on just for the time being.
All right. Wow. You heard it from our doctor here. If you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com.